Welcome to my channel Medicine Guide. Doripenem, Doribax, Finabax, is an antibiotic drug in the carbapenem class. It is a beta-lactam antibiotic drug able to kill Pseudomonas aeruginosa. Doripenem can be used for bacterial infections such as complex abdominal infections, pneumonia within the setting of a hospital, and complicated infections of the urinary tract including kidney infections with sepsis. The greater stability of doripenem in aqueous solution compared to earlier members of the carbapenem class allows it to be administered as an infusion over 4 hours or more, which may be advantageous in the treatment of certain difficult-to-treat infections. It may present a lower risk of inducing seizures than other carbapenems. In this video we will discuss the mechanism of action, and other pharmacology of doripenem. So let's start our discussion, but before that please subscribe to my channel Medicine Guide. So let's start with mechanism of action. Doripenem is a broad-spectrum carbapenem antibiotic with activity against many gram-positive and gram-negative aerobic bacteria, as well as a variety of anaerobes. Like other beta-lactam antibiotics, Doripenem's bactericidal mechanism of action is mostly due to cell death after inhibition of bacterial enzymes called penicillin-bindng proteins, PBPs, which are responsible for peptidoglycan cross-linking during the synthesis of the bacterial cell wall. Carbapenems mainly have high affinity for PBPs 1A, 1B, 2 and 3. Inhibition of each PBP usually results in a different inactivating mechanism. Inhibition of PBPs 1A and 1B results in fast bacterial killing through the formation of spheroplasts. Inhibition of PBP2 results in rod-shaped bacteria to become spherical, and inhibition of PBP3 results in filamentous-shaped organisms. The PBPs preferentially bound by different carbapenems depend on the organism. In E.coli and p.aeruginosa, doripenem binds to PBP2, which is involved in the maintenance of cell shape, as well as to PBPs 3 and 4. Doripenem has a 1-beta-methyl side chain, which allows it to be relatively resistant to dehydropeptidase, as well as a trans-alpha-1 hydroxyethyl group at position 6 which provides beta-lactamase resistance. Like other carbapenems, doripenem is different from most beta-lactams due to its stability against hydrolysis by most beta-lactamases, including penicillinases, cephalosporinases, ESBL, and AMP-C producing Enterobacteriaceae. Adverse effects. Seizure risk. Carbapenems in general have been reported to cause seizure activity in some people. In addition, those who already have a seizure disorder may be at risk for further seizures if they are using valproic acid to control their seizures. Doripenem has been found to decrease serum concentrations of valproic acid. Infection-related. Use of doripenem can lead to Clostridium difficile infection. It has also been noted to increase mortality in people who have ventilator-associated bacterial pneumonia, and is no longer recommended as a treatment for this condition. Dosage forms and strengths. 250 mg single-use vial or 500 mg single-use vial of sterile doripenem powder for reconstitution. Contraindications. Patients with known serious hypersensitivity to doripenem or to other drugs in the same class or patients who have demonstrated anaphylactic reactions to beta-lactams. Warnings and precautions. Increased mortality in ventilator-associated bacterial pneumonia patients. Doripenem is not indicated for ventilator-associated bacterial pneumonia. Serious hypersensitivity, anaphylactic, reactions have been reported with carbapenems and other beta-lactams. Seizures have been reported with carbapenems, including doripenem. It has been shown that co-administration of doripenem for injection with valproic acid reduces the serum concentration of valproic acid. Patients with seizure disorders controlled with valproic acid or sodium valproate will therefore be at an increased risk for breakthrough seizures. Clostridium difficile associated diarrhea, ranging from mild diarrhea to fatal colitis. Evaluate if diarrhea occurs. That's enough for this video. If you want to watch more videos like this, please keep watching my channel. Disclaimer. Channel's intention is to make sure that its consumers get information that is accurate, reviewed by an expert and error-free. However, the information mentioned here should not be used as a replacement for the advice of a qualified physician. The information given here is for informational purposes only, which may not cover all possible precautions, side effects, contraindications or drug interactions. Consult your doctor and discuss your queries related to any medicine or disease. Thank you for watching the video. Please do not forget to like, share, and subscribe to my channel Medicine Guide.